We'll be getting started shortly. Please share your name and where you are joining us from in the chat box. Welcome everyone, and thank you for joining today's webinar, Competencies in Focus, Readiness. My name is Abby Nellis, and I am a Senior Associate with CADCA's Public Health Programs team. CADCA, in partnership with the Center for Public Health System Science at Washington University in St. Louis, is excited to present today's webinar, which is the 6th webinar in our 18-part webinar series on CADCA's Coalition Competencies. Next slide. Before we dive in, I just want to do a quick overview of CADCA. Using a community-led approach, CADCA is dedicated to empowering coalitions and health departments across the globe with the tools, expertise, and support needed to drive positive change in their communities. Through top-tier training services and an evidence-informed technical assistance system, we help build your capacity to implement best practices that improve community health outcomes. To explore more about our work and subscribe to our weekly newsletter, visit cadca.org. Next slide. I'm sure everyone is familiar with Zoom by now, but I'd like to go over a few housekeeping notes. All participants are muted by default, so for general comments, please use the chat box. We will have a Q&A portion at the end of the presentation, so for any specific questions for the presenters, please use the Q&A box. You will receive a post-webinar email with the recording of the webinar, slides, and an evaluation survey. We kindly ask you to fill out the survey. Letters of attendance are given only upon completion of the evaluation survey. Next slide. And now I'd like to introduce our presenters. Today's webinar will be led by our valued partner, Jessica Price, from the Center for Public Health System Science at Washington University in St. Louis. Jessica Price is the Evaluation Manager at CPHSS and oversees evaluation and implementation science projects, including CADCA tools and manuals, Reach St. Louis, and the Rural Communities Opioid Response Program. We are also joined by Dr. Brittany Cook. Brittany is Vice President of Education and Human Development with the Wanderson Center. She received her PhD from the University of South Carolina in Clinical Community Psychology and has expertise in evaluation, organizational readiness, the research and implementation of technical assistance, and implementation science. Dr. Cook has experience designing and implementing mixed methods evaluations through a lens of empowerment evaluation and was part of the team awarded the 2017 American Evaluation Association Outstanding Evaluation Award. Dr. Cook has been partnering with CADCA to support provision of systematic, proactive TA, improve operationalization and evaluation of TA outcomes, and development of practical tools and approaches to enhance TA delivery. Lastly, we are joined by Christina Clark, a nationally recognized expert in coalition building, nonprofit sustainability, and substance use prevention. As the president and founder of KM Clark Consulting Group, she works with organizations across the country to enhance their capacity, improve their impact, and secure long-term sustainability. Her innovative strategies and evidence based approaches empower communities to achieve transformative change. Christina is a trusted national trainer for CADCA, where she has guided hundreds of coalitions through the National Coalition Academy. Her work equips communities with the tools to prevent substance misuse and address public health challenges effectively. Thank you all for joining us today, and Jessica, I will pass it on to you.
Thanks, Abby. It's so nice to be here with all of you. If you are a returning viewer, it is lovely to see you again. Thank you for joining us. I'm really excited for this one today. This is going to be a great webinar. So all of this information started with a project where we looked at hundreds of studies. We looked at resources from around the country. We spoke with coalition leaders around the country and around the world, and we developed with CADCA a set of coalition competencies. What are the core areas where coalitions need to have competency? What are the knowledge, skills, and abilities that they need to be able to be successful and make an impact in their community? And we ultimately organized those into the three domains that you see here: operations, community, and prevention. And today we are honing in on readiness. So I'm going to give a little bit of background to the competency itself before we get to take a really deep dive with Brittany and with Christina on this content from their areas of expertise. So you'll see that we first defined readiness, as we are going to be talking about it with coalitions: the extent to which an organization is both willing and able to implement a particular innovation. And we looked at, why is this important? So in the evidence, we know that readiness supports quality implementation throughout all of the stages of activity, that awareness of a coalition's, that your own awareness of a readiness level is important to be able to tailor strategies. And we know that this can be built in combination with other competencies like assessment and planning, that these skills and knowledge areas can really grow together to benefit coalitions and to benefit communities. So what are the knowledge, skills, and abilities that define being competent in readiness? So to build toward that high degree of competency and readiness, we're looking at knowledge areas like understanding your community's readiness, knowledge of readiness principles and stages of change, understanding the resources that you have and could potentially have, knowledge of the training and the resources that are available to help you develop your readiness, and the knowledge of the strategies that you're preparing to implement the evidence-informed prevention strategies. Building on knowledge, there are a number of skills that are evidence-based skills that coalitions need to be successful in this area. So being able to being able to assess your readiness, being able to communicate those results and talk together about what they mean and what you're doing next leads nicely into strategy. How are you going to plan, select the areas that you're going to work on improving, and then tracking your progress over time, tracking your readiness over time, so that you can see how things are going and then adjust and adapt, reach out for resources as you go. All of this builds into a handful of abilities that are at the core of this competency, of being competent in readiness. And that's the ability to motivate others in these activities, the ability to build general capacity, because all of those capacity components are going to interact with readiness, the ability to also build innovation-specific capacity. So not only your larger capacity as a whole, but the capacity to be able to offer a specific intervention, and then doing all of that with a lens that leads toward long-term planning and how you have flexible long-term plans that account for your readiness and prepare you for growth and impact. So with that introduction to the competency, which is now available for everyone, I am so thrilled to pass this over to Brittany Cook for her presentation on readiness.
Thanks, Jessica. So as Jessica talked through the competency of readiness, she touched some on what it is and why does it matter. And we're going to dig even deeper into that for this portion. Next slide, please. So we're going to talk about what readiness is. Why is it important What does this mean for you and your coalitions? And we're going to share a model for readiness. It's called R equals MC squared. And I'll explain that in a moment. And subcomponents. So this maybe sounds ambiguous at the moment, but we're going to dig into like what can this look like, and what does this really mean for your coalition and your organizations? And then we'll talk a bit about some readiness principles for you to consider as you're thinking about readiness as a competency. Next slide, please. So even though we talk about readiness all the time, not everybody thinks about readiness in the same specific improvement focused way. And having a shared understanding about what readiness means is really crucial for a coalition because it ensures that everyone's on the same page about how prepared they are to implement prevention efforts successfully, right? When people understand readiness, they can better identify strengths and areas that they could improve. And this common understanding can help coalitions to set clear goals, make informed decisions, and work together more effectively toward reducing substance use in their communities. Next slide, please. So there are a lot of reasons why readiness is important to consider. We all know that reaching desired outcomes is really hard. We want to make an impact in our communities. We want to improve health and outcomes. And that's challenging. That's hard. And complex problems like prevention and substance use and misuse, those are not easily fixed. They're complex, they're multifaceted, there's a lot going on, a lot to consider. And there are also multiple strategies and frameworks that are, best practices and evidence-based, and you can use them and you can implement them. But there's a lot to consider. So how do you, think through all those things, and how do you know if you're ready for each of these things? And it's really essential to be ready to address these problems so that you can implement all these different best practices with quality. Next slide, please. So as Jessica said at the beginning, right, readiness is the extent to which a organization, a person, a community is willing and able to implement an innovation. And when we talk about willingness, we say that's motivation, and able, that's the capacity to do it, right? You can and you want to do this and make this change, make these changes, implement this innovation. And then an innovation can be defined as a program, a practice, or a policy being implemented in a setting. Next slide, please. So I teased you with R equals MC squared at the beginning. So this is really a great model for understanding readiness and thinking about readiness in a way that is really has a lot of utility, and we'll get there. So hopefully it's easy to remember. R equals MC squared, and R is readiness, M is motivation, and then there are two types of capacity to think about, and that's general capacity and innovation specific capacity. Can you click? Thank you. Perfect. So you can think about motivation and the two types of capacities as legs on a three-legged stool. They're all important. They're all essential. And if you're missing one, that stool's going to fall over. And that's why it's a multiplicative formula. We've got, motivation times general capacity and innovation specific capacity. Each leg is important if you want to really be ready to implement. Next slide, please. So R equals MC squared. Readiness is made up of motivation, innovation, specific capacity, and general capacity. But those are really big buckets. If you say, hey, we're motivated to do this new innovation, implement this new strategy, what does that really mean? Is everyone going to understand it the same way? And what can you do if motivation is low or motivation is actually a strength and some capacity is low? Next, click. There we go. So we call motivation, innovation, specific capacity, and general capacity the components of readiness. And below them are subcomponents. So rather than just trying to understand if motivation, this broad category, is high or low or a strength or a barrier to implementation, we've done extensive literature review and looked at, what does the evidence and science say it makes up motivation when it comes to organizational and coalition readiness. And so there are subcomponents for each of these big bucket components. And what's really great is that means that you can identify and really target what's the particular, like the specific area that we have a strength and the specific areas where maybe we have some barriers or some challenges to consider. So we're going to go into each of these subcomponents in a bit more detail. Next slide, please. So I'm going to give an example and kind of describe what each subcomponent is with a coalition lens. So again, what's really wonderful is that you don't have to just think of this big bucket of motivation. You can really break it down and say, where do we have strengths, where do we have barriers? And we can assess this by understanding, having the shared understanding about what we mean when we say motivation or general capacity. So motivation is specific to the innovation you're considering or you're thinking about implementing. And relative advantage, this first subcomponent, means like the coalition members believe that a new prevention approach will be more effective than what they're currently doing. So how is this different from what you're currently doing? And is this something that people believe will be more effective? For compatibility, considering compatibility, you'd think like the prevention strategy really aligns and fits with the coalition's values and their goals, and the needs of the local community. So how does it fit? Simplicity. This strategy is seen as easy to understand and feasible for coalitions and partners to implement. Does it seem simple? Does it seem straightforward? Or is it really complex and complicated? Are there lots of pieces and moving parts? Or is it, again, fairly simple? Observability. Coalition members and stakeholders can see visible and positive results from early implementation of the strategy, or they perhaps have seen other coalitions or other communities implement it well and have seen the impacts of implementing this particular innovation, this practice or policy or program. And so can you see the impact in the short term? Or do you have to wait a long time to really see if this particular innovation is going to make a difference? It can be really motivating if you can see change, the impact of change right away, right? Um, okay, the next subcomponent is ability to pilot. Can this be tested out? So can the coalition pilot the approach in like a small setting before committing to a full-scale implementation, right? So you can test it out. Can you pilot it in a small setting? And then priority. Communities are faced with lots and lots of different things, and coalitions work on multiple things at once. So priority refers to how important a specific prevention strategy is perceived to be by the coalition and the community compared to other pressing issues or initiatives. So there's lots of other things going on. Something might fall by the wayside, something might be competing. So it's important to be able to think about and kind of assess all of these subcomponents to say, where is our motivation to implement this strategy that we want to implement? Next slide, please. All right, so our next component is general capacity. And general capacity, again, is really how a coalition functions day to day, just what you need to be able to function and function well, regardless of what strategies or innovations you might be implementing. And many of these subcomponents are probably familiar things you think about and you've heard of. I'm going to give a quick definition kind of example for each of these as well. So culture in a coalition, right, it refers to having shared values and beliefs and norms that shape how members work together to approach their prevention work. Climate describes the current atmosphere within the coalition, including how supported and included and connected members feel to their roles and to one another. Innovativeness. This refers, right, to how open and willing a coalition is to try new strategies, tools, or approaches as opposed to kind of doing the same old thing. So, you're working in a coalition that kind of likes to do the same thing and is stuck in a rut, or are people really receptive to trying new things out? Structure refers to the specific roles, the resources and processes the coalition has in place. So just how they're structured, and this can really impact their function, right? And that's an important component of general capacity. Leadership. So if the coalition has a strong, committed leader and leadership that supports and drives efforts. Staff capacity. We say that this is about having enough of the right people. So does the coalition have access to skilled individuals, both staff and volunteers, who can plan and carry out the activities the coalition is trying to do? And their resource utilization doesn't just refer to monetary resources. This is time and effort as well. So is coalition able to effectively manage funding, manage volunteers, in-kind resources, the time to support the goals that the coalition has? Next slide. And our last component is innovation specific capacity. And this is, I think, often where people think they jump right to this when they're thinking about doing something new and implementing a new innovation. And often it's particularly around the innovation specific knowledge and skills, this first subcomponent. And so innovation specific knowledge and skills, this means, does the coalition understand the specific prevention strategy, know how to implement it, understand it, and know what to do and how to do it? Right, so this is kind of the nuts and bolts of how to do the thing you're trying to implement. And again, a lot of times people think about that and then maybe don't consider some of these other important innovation-specific capacities. So the next subcomponent is having a program champion. So does the coalition have a passionate individual who really actively promotes and drives the adoption of a particular strategy or innovation? Supportive climate. Does the coalition foster a positive environment where members feel encouraged and supported to work on this specific prevention effort? So again, this is all around a specific thing you're trying to do. It's not everything generally, but a particular strategy or a particular program or a particular policy you're trying to put in place. And then the last two around relationships. So we know relationships are extremely important and they really matter when it comes to being able to implement a particular innovation. We've got the inter-organizational relationships, and those are the relationships with the outside of the coalition. So that's having strong partnerships with the different sectors and organizations in your community, like schools or law enforcement or healthcare, and other community organizations related to the specific strategy or the specific innovation. And then the intra-organizational relationships are the relationships within your organization, within your coalition. And so a great example of like strong intra-organizational relationships would be a coalition maintaining strong communication and collaboration among members to ensure smooth coordination for a specific strategy or innovation you're trying to implement. Next slide, please. So hopefully, R equals MC squared and all these subcomponents make you feel positive about thinking about your coalition's readiness, because now you've got some ways to think about how to target, where do you have strengths and where there might be barriers. And there's some other things we call readiness principles we just want to touch on as well that are important to consider when you're thinking about readiness. So first is that readiness can change over time. Readiness isn't static. Even a highly ready coalition can lose capacity or motivation over time due to internal or external shifts. So just because everything's really high and great at one moment in time doesn't mean that that can't change. It's important to be aware of that and to consider that as you're, thinking about this competency. Readiness is important throughout the life cycle. So readiness needs to be monitored and strengthened before, during, and after implementation, so that momentum can be sustained and impact can be sustained, right? So having high readiness when you're getting ready to start and you're preparing to implement is really important, but you have to keep in mind that it matters to be ready to implement and ready to consider sustainability as well. So think about the life cycle of implementing an innovation. Readiness is also innovation specific, which I've touched on a few times, and it's just really important to think about too, that being ready for one prevention strategy doesn't mean that a coalition is ready for another. Each innovation has unique readiness requirements. So you can't just say, oh, we're high, and then assume that you're going to be high on a completely different strategy or practice or program or policy, right? So readiness is innovation specific. But again, that lets you, have a really good way to assess, where you are and where you have strengths and barriers. The fourth principle is that readiness applies across different levels. So just like you could be ready for different innovations, different people within your coalition can have different levels of readiness for something as well. So you need to think about readiness and so motivation and capacities for coalition leaders, for staff, for partners, for community members. And this all helps to ensure successful implementation. So, does everybody have high motivation and capacity? Are there particular capacities that, maybe staff are struggling with more than leadership? There may be variation, right? And the last piece, the last principle, which is my favorite, it's really exciting, is that readiness can be built. So you don't have to feel stuck if you're struggling with readiness barriers and with, motivation and capacity challenges. Readiness can be built. And so assessing that readiness and identifying where you have barriers. You can identify supports and strategies and, put some time investment into building readiness and both general capacity and innovation specific capacity and motivation can all be built. And as Jessica said, some of the other competencies can also help you to get there too. So readiness barriers don't have to stand in your way, and readiness can be strengthened to support success. And I'm going to pass it now to Christina Clark, who's going to give some examples of readiness and coalitions.
Thank you, Brittany, so much. And I agree. I think what our example here is going to showcase and illustrate to everyone is that readiness can be built. And that's what I think is so exciting about this. When we identify there's a barrier, we're able to figure out how we can overcome it with the R equals MC squared model as part of these readiness components. And so I'd like to take you through an example of this and what it can look like in real life as you're working with your coalition. And I have, as Abby was introducing me, the privilege of working with coalitions across the United States and the privilege of working with lots of other people in coalition, including some of the great ones in Indiana. And I get to work with Kim Linkle from Batesville, Indiana specifically. And so as we were talking about this, I thought this was a great example to move you through what Brittany and Jessica both showcased already. And so it's really asking ourselves, are we ready to move on something, right? And so coming from this was pre-COVID. Was starting to talk about that we needed more access to naloxone in Batesville. And so they're saying, okay, we know it reduces opioid overdoses. We know bystanders are often present. So we want to make sure they have access to it. And the Center for Disease Control is coming out with multiple studies saying, hey, the more community distribution we can get, more public access, the better it's going to be. So what we're seeing here is what so many of you incredible preventionists in the room know is that we're starting to see a great new strategy come up, something we can dive into, sink our teeth into to have community change. And so what you'll see happens is that that's presented to the coalition and we say, okay, can we do this? Go ahead, next slide, please. So here's the local challenge. They're like, okay, we're hearing this, the CDC, the change is coming. We want to stop overdoses. And so the proposal here is, okay, let's install naloxone boxes in city-owned buildings and private businesses, places throughout the community, right? And the idea here is we're taking on something new. We're both stepping into harm reduction at the time for this. I know a lot of you have already done this work. And now we also have a new strategy involving harm reduction we haven't been involved with yet. So we have to ask ourselves, are we ready for this, right? Can we take this on? Is our coalition ready to take this on? Next slide, please. So when it was first proposed, then, like I said, pre-COVID, there was some immediate pushback. Because remember, take you back in time here when this was first starting to be something we were talking about. And there's definitely from some key stakeholders, this police already carry it, so why do we need it in other locations? Some stigmas around sending the wrong message if we had this all available, stigma around treatment, of course, things like that. And this was really coming from both the mayor's office at the time and the police. Like, listen, we already have this handled. We don't want this all over. And these were key stakeholders. So that provides one of those barriers that we're talking about. But there were some supporters, of course. There are some people in healthcare from overdose groups that were saying this is really important for access. This could save lives. And there's not always a police officer on deck ready to go when something like this happens. So this is where you start to see these barriers come up, these readiness challenges as something new is emerging for this coalition to put into place. Next slide. So this is when we start looking at what Brittany took us through, which was the R equals MC squared, and say, okay, we're hearing something, but why is it happening? And can we use these to diagnose where we can start diving deeper into and provide some strategies around to build that readiness? Because as Brittany says, readiness can be built, right? So it's not just that we're saying, hey, readiness is an issue. We're not going to move forward on this, even though it's a good idea and CDC says it's working, we're getting too much pushback, we're not going to move. Instead, we're saying, okay, let's figure out where we need to build readiness so that we can move forward on something we know is going to be impactful and effective in our community. And so in looking at this is just a snapshot. I'm going to go into each one of these more. But when we look at that first component of readiness, which is motivation, that's where we see a lot of mixed reviews, right? Like I said, we have the health department, the suicide overdose team, the choices emergency response team, all being like, this is a great idea, y'all. We should get on board. To then the mayor's office and the police being like, I don't think that's a great idea. We're not motivated to do that. We already feel like it's duplication of services. We've got it covered, right? But then you look at that next component, which is the general capacity of the coalition. They're a great coalition. They're a strong coalition. They have all the sectors sitting at the table. They're all working together. They got a great structure, right? They're in a solid place. They got a good foundation. So that's not something we need to look at building readiness on. That's not the issue when it comes to moving forward with this strategy. And when it comes to innovation specific, so specifically, if they're able to move forward with putting the locks on boxes, if everyone was motivated to do so, it was a little bit of everything because it is new territory, right? So we got to learn a little bit more. We might be strong in public messaging, but we're a little worried about how we would distribute getting this work done because we're not completely funded for it yet. So how can we leverage the partners? So this again is a really thoughtful way of saying, not that we shouldn't do something, but how do we do it really well and take a minute to see how we can get everyone on board and move them to be motivated, and then how we can be really thoughtful about putting the strategy in and doing it well. Next slide. So again, with motivation being the first one we're looking at, it really is about building that will to act, that they want to have something to do with it. And as we talked about, the major pushback were from two huge stakeholders for any coalition: local government with a mayor and the police department, right? We need to get them on board. We can't do this without them. It's really important to have them be part of this process. And so it was important for them to look at the issues were really that they felt like they were duplicating services and they didn't really understand why this was important, and there's some stigma attached from it. So between pre-COVID to as we're moving through COVID and starting to see some traction with being able to implement this strategy, one of the things they were able to work on was building this part of it, right? So they started to look at how do we get this to be a priority for the mayors and law enforcement? And one of the ways of doing that is linking it to the city's strategic goals. How does this impact them? We've talked about it a lot in coalition world, the what's in it for me. How do we showcase that doing something about this is going to be beneficial to them? And so looking at public safety and the cost avoidance, if we're able to do this, and the relative advantage of saying, that's great, we love that law enforcement had this, but what about those times where there isn't police and we're waiting for EMS to get there? And so this really came to light for them when they started to see the overdose data, see when these things were happening. Again, that's when they pulled in a stakeholder that was really motivated to do this with the suicide and overdose teams and the choices emergency teams to really start to educate on what was happening around overdoses so that police and the mayor's office could make more informed decisions. And that's really what we're trying to do. Again, it's not to say we're going to move forward without them or say that we shouldn't do this at all, but how can we take their main issues within motivation and provide the support, education, whatever it is, to move them along this? And so what they found was by bringing these other stakeholders that were on board who had this data, they were able to change the perspective of the mayors and the police departments to move forward on this. And again, this took time. So we started this pre-COVID, and then we know stuff happened, right? And then so this starts to emerge as something they ended up being able to build readiness for right after COVID, because they were able to really address the stigma and the idea of the duplication of services in between that time. Next slide. Go ahead and push next slide. Sorry, I got a cute little emblem up there. So general capacity, like I said, they were strong here. They're a great coalition. And so really they're asking themselves, can our coalition execute with their current capacity? And so they really felt like, yes, they had strong structure and internal operations. They knew they had the right partners at the table to do this. They were able to they had a good workflow plan in terms of how they had committees and work groups, how their board worked together. They had strong staff support with leadership as well as board member support. They, like I said, had already had great resource utilization in terms of getting data around overdoses, in terms of getting information from treatment facilities. So that was a great capacity that was already built generally for this work. And then they had an overall, this community rallies, which is so important in the work that we're doing. They knew the culture of the coalition was strong, and the overall support of the community for whatever they took on was really strong. So they knew they could rally it together. Again, just showcasing that their two major issues were really around the motivation piece as they were moving to implement this strategy. Next slide. You can do 2 clicks because, yeah, I got the little. With innovation specific is another place that they were like, okay, we have some things we just need to work through, not stop, but work through, because this goes beyond we care and into, can we do this really well? Once we get everyone motivated, we know we have the general capacity. How do we make sure we have this innovation specific capacity? And so do we have the technical knowledge and skills needed to implement these naloxone boxes? And so this again is where that partnership came in really handy, because this doesn't necessarily mean that you as the coalition director or prevention coordinator has all of this in your head. It's also saying, do the partners and people sitting at the table have this information? And so there, of course, there was some learning curve, and can we get the specific knowledge and skills on vendor selection, on legality, on training to make sure we can do this, make sure we get the information out there to the people who can really help make sure this happens in the community. The support clients. So there was that mixed feelings that this was a good idea among whether it was law enforcement and mayors, and then the health community. And a program champion they did have. So with the suicide and overdose team, the Choices Emergency Response Team, but also local businesses came on board and had strong support for this happening. And so, like I mentioned, and thinking about R equals MC squared, you had those things and motivation that were really their highest level barriers that they need to tackle, strong in general capacity. And then they said, okay, great. Now, once everyone's motivated, what are those things we need to get into check to make sure that we can move forward with great implementation to get the impact we want to see when it comes to those boxes? And so what they were able to do between those times is, as they were building a motivation, as they got the mayor on board and the police chief to see with the overdose rates, with what they were seeing in terms of how they could support and stop that, they're able to finally get 3 boxes in their community. So they were able to get one a mile away from what was like city center, where the police station, mayor's office and such is. So a huge win, when before they were saying, no, they didn't want it. And that was at the Community Mental Health Center, which was 1 block away, not 1 mile, sorry, 1 block. They were also able to get one in the major resource center, the Batesville Area Resource Center, which is where everyone goes to get supplies, things like that, any resources they need, the community food bank, etc. So great location for it, as well as one of the major businesses on the other side of the highway. So they were able to provide like support in all 3 areas of their community, was at Batesville Tool and Die. And what was great about that is they also trained all their manager and staff in using it and had it on site. And so again, it's just really important to note that you could have easily been like, okay, 2 of our major players don't want it, we're not going to move forward on it. Instead, it was this thoughtful approach of, okay, where are these barriers? How can we tackle them so that we can move people along this readiness continuum? And I want to reiterate something that Brittany said. This wasn't just about one specific organization or individual. It's looking at it at both levels. How can we move the whole entire police department and an individual mayor along in their readiness to take this on? And so in a few years, they were able to do that, providing this additional access to overdose support in their community. So I think this is just a really great example of how, when we sit back and really think about, not that this is a no, but a place to diagnose where there are some barriers, that we can really move effective strategies along by addressing readiness in this comprehensive way. Next slide. So what can you do? As we've given you all this information, we've filled your noggin with all of this. This is what, as someone who's a coalition director for 10 years, readiness, I think, is so important to moving us along. And so when can we address this? What can we do? Whenever we're looking at new strategies or initiatives. So as we saw here, this was a new time for them to dip their toe, and not just a strategy of the access to overdose reversal, but also looking at harm reduction generally. So as a new strategy or initiative comes in, as we see emerging drug trends, as we see something, a new policy that might need to be implemented, it's a great time to sit back and say, where is everyone at with this in terms of motivation, general capacity, and innovation specific capacity? When we have changes in strategies or organizationally, so we have a new staff member, we have a new structure to the way we're doing things. We just have a change in the way we're going to implement. I always say, like, we're always adapting, we're always getting better in the work that we're doing. And so when those changes are coming up, there's always feelings. We've all been sitting at a coalition meeting and be like, why are we changing that? We've always done it this way. But we know in our gut it needs to change to be more impactful. That's your flag to say, this is when we need to be looking at readiness, so we can see what's holding people back on changing this. The third, and this is really my favorite, especially if you have been in this work for a long time, I know you have seen this. It's a great way to uncover bottlenecks and get through them. So if you continually see something on your to-do list, it keeps coming up there. You have it on your strategic and action plan every single year and you haven't moved on it, but you know it works. It's an evidence-based practice. It's a great policy that you could be putting into place and it's still not moving. That is your sign that readiness needs to be addressed. It's not that it's the wrong program, policy, practice. It's probably that one of those things, a motivation, general capacity, or innovation specific capacity isn't being addressed in your coalition. So I highly recommend one of the things you do when you leave here today is say, what are one of those things that keep coming up that is on my list? And utilize the readiness framework as a way of uncovering how you can really tackle that and move forward on a great strategy in the other. It really does help you clearly define barriers to implementation. My favorite is it does build consensus. You know, one of our main jobs with coalitions is to build collaboration and partnership. So when we see something like our mayor and police not being on board, that's an issue. Like, even though sometimes we can run with something without them, we really do want to bring people together on this. And so I find it's a really great way of building consensus, finding out why people don't want to move forward on something and unpacking that. And I say it all the time. We don't ask enough questions of why people feel a certain way. We just hear them say no, and we're like, okay, we won't move forward with that. Ask why. What is your hesitation towards this? What do you think the impact's going to be? We have to be better about having those conversations. And this kind of format of looking at readiness helps us do that and really does help us build consensus. Even if they're still not gung-ho, they'll at least understand why you're moving in that direction, which is really important. And it really does help define a starting point for you when you are struggling with implementation, when you are struggling with putting in a new strategy or moving forward with something that's been bottleneck. It helps you figure out, where do I start? Instead of just saying no one wants to do it or this is hard, hey, how can we up someone's how they see relative advantage? How do we make this a priority for this organization we're looking to work with? So it gives you somewhere to start to make movement and a good strategic plan to making movement on that issue. Next slide. And so finally, as you leave thinking about readiness, plan to do this at your next coalition meeting. Have these conversations. It should be an open conversation. We're talking about readiness. It's also great to utilize. There's a lot of funding opportunities out there as we come in to the new year, like strategize and utilize as part of writing funding proposals, how you can build readiness. Is this a good idea to be moving this in there? Is it something that's going to take longer to get people on board for? We should put it farther away in our strategic and action plan, like a year out instead of in the first 3 months. And you can also utilize this as having a conversation with board and staff for decision-making and next steps. So there's lots of different ways to build readiness. I just encourage you to take those next steps to figure out how we can utilize this as we move forward. And remember, this is a new tool in your toolbox to make these strategic decisions and move the momentum forward. And with that, I'll hand it back to the team.
Thank you, Christina, Brittany, and Jessica. So you all might be wondering, how can I increase my coalition's knowledge, skills, and abilities in readiness? Next slide. Well, here at CADCA, we focus on this crucial competency during, of course, our National Leadership Forum, our Mid-Year Training Institute, and through various coalition services training programs. We also focus on this through our National Coalition Academy. Next slide. In fact, as you can see on this slide, assessment is explored in depth during week 1 and week 2 of the NCA. Next slide. While we are moving into our Q&A, I'm going to go ahead and put the survey link into the chat, and I'll ask Jessica to go ahead and pull up the QR code. We kindly ask that you take a moment to complete the evaluation survey by scanning the QR code or using the link in the chat. Please note that letters of attendance are only given upon completion of the evaluation survey. So let's move into our Q&A portion, and please remember to put questions in the Q&A box. And as we wait for some of those questions to file in, I'll go ahead and start with one of my own. How should a coalition director proceed if they have received funding to address a specific issue in the community, but the coalition's motivation to address the issue is low?
That to me. or any of us?
Love you.
Can you ask it again one more time, Abby?
Yeah. How should a coalition director proceed if they have received funding to address a specific issue in the community, but the coalition's motivation to address the issue is low?
Yeah, I think we've all been there before. As funding changes and someone jumps in, they're like, now you're going to be tackling this. And you're like, wait, but everyone was so excited to go after this plan. I think what I like about, and I'll hand it over to Brittany for her expertise on this, but why I like this is it gives you a starting point to talk to funders about. So without a doubt, there's always a planning period, and this gives you a moment to look through and say, okay, if we're not motivated, why, and what information data do we need to provide to get to that motivation? So for instance, I think about this when in my community, early, 2010s, the methamphetamines was huge. It was a big push, but then opioids started to be funding, and there's this switch that had to happen with people. And it really did take us providing data, figuring out where their barriers were with what they thought if we were leaving methamphetamine behind, which we weren't, and just getting them the right information they needed to move on that and finding small wins. And what I think I love about this is this does allow you to have a plan of attack for readiness so you can get them on board while finding those small wins of like, okay, can we just agree that we're going to do a training here as you work up to something like policy change? You're looking at it through the comprehensive strategy lens. So I think for me, it finds some steps that you can take so you could showcase those funders that you are moving people to build that readiness. Brittany, anything to add there?
Yeah, I would say too that so you're saying that like motivation to work on this particular area is low. And so it's really nice about R equals MC square and having those subcomponents is that you can assess those different areas of motivation. So like Christina was saying, is it because there are other priorities they're worried about? So what's really great is you can dig into it. You can identify like, is this a strength or a barrier? And then you can dig into, well, what more do we need to understand? It really does help facilitate conversation. So if they're concerned that other priorities are going to get pushed by the wayside, how can that, impact the way that you're messaging and communicating about things? If there's, maybe there's just, the observability is low. This is a new area that they haven't worked in before. Well, maybe there's some other communities that have done this work for a while that we can pull from and say, look at the impact that working on this and doing this strategy or working on this particular area can make in these other communities and can make in our communities. And I would bet that there's probably also data that could show and examples that could show how that could also have a positive impact on the other areas that they're already interested in and want to continue supporting and improving as well. So I think that like Christina said, it's a bit of a diagnostic. It lets you say, okay, where are people's pain points? What are the barriers that we're seeing? And then helps you to plan what you can do about that to really make sure that you're not just barreling forward, but addressing their concerns so people feel like they're heard. And that concerns are taken into consideration as you're planning and moving forward and communicating.
Thank you. Christina, specifically in your presentation, our portion of the presentation, you talked about a program champion. And so I was wondering, what do you think a coalition should be looking for in a program champion?
That's a great question. So I think we struggle with looking for program champions in obvious places a lot of times. And what I think is interesting, what came out here, yes, there were some obvious ones and the choices, emergency and overdose response, but then there was also the local business that came in. And so I think we're looking for a program champion. We're looking for someone who can be a voice, not just for the program strategy or policy we're implementing, but an influence to the people around them. And what was so important about this is this was a large business in the community, somebody that people looked up to that was able to say, this is something we want to do too. And so I think you want to match that. I think sometimes as coalitions, we really depend on kind of the obvious choices for program champions. And I think I want to really encourage you to look for those influencers for people around the community that will really feel moved and supported when they say, yes, we're backing this, that it gets that type of momentum that you want to see. So yes, look for your in health, those people like the overdose that are going to be, yes, gung-ho for you, but also be sure to look for things like in the media, business spaces, chambers, things like that can really extend your reach for both excited about and understands the program or strategy you're putting into place, but also can influence and inspire the people in the community to move.
Thank you, Christina. It looks like we're still waiting for some questions to come through. So if none come through, I'll just ask one more question. Oh, well. Someone just asked a question. Someone said this seminar is very timely. We are at the beginning stages of developing an overdose prevention coalition in our county. We have conducted 6 focus group sessions, analyzed and shared data regarding community concerns. We have convened a steering committee, discussed focus group data, and have been presented with EPI data regarding local and state data. Had 4 meetings, developed vision, mission, strategic priorities. We have had stalled conversations regarding action teams to support the priorities, with some members hesitant and need more info, and others ready to dive forward and start work group development, which is hard to navigate. So any advice, Christina and Brittany?
Brittany, do you want to go and then I can go?
Sure. So I can say first that, one reminder, so it sounds like general capacities are like building, and that's fantastic. And I think that the other important reminder, right, is that when you think about motivation and innovation specific capacity, they're both innovation specific. So it can be helpful to understand broadly motivation and capacity for particular areas. But then it's even more helpful when you start getting to what are the strategies that we're going to try to implement and we want to consider implementing. So my first level of advice is that readiness should be embedded within another, like a planning and implementation framework that will help you to kind of move forward in that process and make sure it sounds like you're doing a lot of it already with your strategic planning, and you've done a lot of data and evaluation, which I think is fantastic. So I would say that maybe like a simple next step would be, simple's not the right word because maybe never simple, but thinking about like what are the strategies that you might consider. People want to know more information. So what are some strategies you could consider? And then let's look at the readiness of our work groups and of our coalition to work on those particular strategies. And that could give you some really valuable information about which ones might be a good fit for where you are in your coalition is now. And which ones you might need to, maybe not consider right now or need to build some readiness for before you move into them.
Yeah, and I would add to that, I'd be interested to know what they need more info on. And so asking those questions is where I go, I feel like we're just afraid sometimes to ask. And I say this all the time, like, if you have someone, we all know the feeling, we just led a meeting and someone who's usually engaged leaves and they seem off and we're just like, oh, and we don't think about it, just call them. Just call them up, ask if it might be that don't do it as a group, separate it and ask individually what are you hesitant about? Because it either is the strategies as Brittany's talking about and how then can we build readiness to make them feel more comfortable with it. But is it also maybe the structure of how it's being done? So is it that they're not ready to commit to a whole action team and that's what they need more information on? And then to me, I go, okay, how can we put this in digestible pieces that they do feel ready to move on? Like, can we do a smaller task that they might be able to move on for some wins before we build up to you're going to be part of a whole action team? So I think I would take it that approach, like ask more questions, but then also see if it might be not the specific strategy, but maybe even the structure of how they're thinking about tackling those strategies. But I do want to encourage you that one of the pieces I love is this is consensus building. So having a conversation around this is really helpful in doing it in a way that makes everyone feel heard. And then you can make some strategic moves from the information they provide.
Thank you, Brittany and Christina. Okay, we will, as we conclude today's webinar, I just want to give again, a big thank you to Christina, Brittany, and Jessica for everything that you presented today. And I also want to thank our webinar attendees for attending. Our next webinar will be on November 5th at 2 p.m. Eastern Standard, and we'll focus on community engagement. Please be on the lookout for the registration link. You should be receiving an email within the next couple of weeks with that registration link. And this is just a reminder to, again, please fill out the evaluation. I dropped the link in the chat again if you need it. But if you have any questions about today's session or where you can find this competency at CADCA, please feel free to reach out and contact me at anellis@cadca.org. And thank you again for joining us today.